Good afternoon. Thanks to all who are joining us for the first time, and welcome back to those who have joined us previously. The Erie County Department of Mental Health is happy to be able to offer another session of our Workforce Collaborative Training Series to our providers in the community to support workforce retention and provide an opportunity for individuals from our provider community to share their expertise. We are excited today to have Kelly Marie Wofford, Director of the Erie County Office of Health Equity, with us to talk about a community approach to improving minority mental health. A few quick reminders before we get started. At the end of this session, we'll be asking everyone to complete a very brief evaluation. We hope that you take a moment to fill this out so we can continue to improve our training series. Stay tuned for more information on our training for August. We are currently finalizing details on that. We will be sending out the announcements for the August session, or you can go to our erie.gov/mental health website for announcements and registration information. All of our presentations and recordings from our past offerings are also posted on our website, so we'd encourage everyone to check those out as well. The recording of today's presentation will be posted next week. We are always looking for volunteers to share their expertise with our community of providers. So if you're interested in doing a 1-hour presentation, or if you have interest in a particular topic or have a presenter to suggest to us, please indicate that in your evaluation, or you can contact Amy at amy.rockwood@erie.gov. The training today is being recorded and everyone is muted. So if you have questions, please put them in the chat box. I will be monitoring the chat during the presentation. So thank you all again for joining us today. And I'd like to introduce Kelly Wofford to talk with us on a community approach to improving minority mental health. Thanks so much, Kelly. It's all yours.
Thank you, Kathleen. Thank you, Amy. Thank you, everyone, for logging in today. I can't see everyone's names, but I'm sure I know 2 or 3 at least that are here today. And one of the things that I would like to do is to be as interactive as possible to kind of guide the conversation, to answer questions you may have, or to talk about issues that may be directly affecting you, your organization, or the communities in which you serve. And so, yes, I am the inaugural director of the Erie County Office of Health Equity. The office was created in 2021 to address health equity issues in Erie County. Today, I am wearing both my equity hat, but also the hat of a person with lived experience. I live with several mental health diagnoses. And I use my health and use my journey to help inform the work that we do here in the office, as well as the work I do out in the community. And so I would really like to encourage you to participate via chat. If something I bring up is something that resonates, or something you like for me to dive a little deeper into, I will do my best to accommodate that. And so if you have questions throughout the presentation, it's not really a presentation, I'm just talking. So there's no screen sharing. There's very little data. I will bring up data adjacent points, but not specific data points to discuss, because I don't want our conversation around mental health and what it means to have a mental health mindset or lens when it comes to community, to be obscured by data, which is counterintuitive, right? Because we know that data rules the land. At the same time, no group is a monolith. And I'd like to start just in that space and kind of talk about what that means. So, we are quick with our data, lenses to group people because it makes life easier, right? It helps us explain the most complex things in life in a way that helps us do our jobs, right? It gives us for some purpose and justifies the work that a lot of us know is important. I know that everyone here can probably identify with having parents or caregivers that help raise us, right? I don't believe anyone's been raised by wolves. And so when you look at your life experience in your household, whatever that looked like, no matter what the situation may have been, whether you grew up with biological parents, if you were adopted, whether you grew up in the foster system, whether you grew up as a group of siblings that helped raise each other, like no matter what your experience has been in life, right? That experience within that household or within that group of people, it's going to be different for every person in that group. So if your family dynamics are different, right, just imagine what the community dynamics are. And so while we do group, and it's important for us to be able to do that, it is even more so important to understand that no group is in fact a monolith. And so I wanted to take a few moments to tell you about myself and how I grew up, where I grew up on the east side of Buffalo. And when I say the east side of Buffalo, it is automatically, because we're human beings, gonna bring up, certain ideas and experiences for folks. And pretty much guarantee, right, that my experience is similar to many folks that grew up on the east side of Buffalo, that grew up in Buffalo, that grew up in Western New York, and at the same time, very different than most people, because my family structure was not the same as everyone else's. My community was not the same as everyone else's. My neighborhood is not the same as everyone else's. And so I personally, yes, grew up on the east side of Buffalo, but I grew up on a street called Hughes Avenue. It's right where Canisius College is, where Jefferson and Main Street meet. Jefferson ends at Main Street if you ever follow it down to the end. And so some of you may know that part of Buffalo as Hamlin Park. It's a few blocks over from East Delavan. And so I grew up in the second block of Hughes Avenue. Growing up, I thought Hughes was the longest street in the world because we had 2 blocks, not just one. And I grew up between Humboldt and Meach Avenue. And so for me, growing up as a kid, it was a multi-generational house, a duplex. My grandmother and grandfather owned the home and lived downstairs. I grew up upstairs and lived with my mom, who was both a single mother or single woman and the only parent. I think that is important to differentiate. So often we hear the term single parent, and it doesn't mean the same thing for everyone. Right? There are plenty of people who are not with their partners that they have had children with, but it doesn't mean that they are the only parent of that child. And so my mother was both single for most of my childhood and was my only parent providing care. And so my house, growing up on Hughes, having Canisius College down the street, I have memories of, naked college kids, skiing down the street in the winter, holding on to the back of their friends' cars, and beer cans being picked up on a Saturday morning because of the Friday night parties. And that's not the same experience as most folks that grew up on the east side of Buffalo. Many folks would tell you that's not the east side of Buffalo because of where it sits in its proximity to Delaware Park, or not the real, east side of Buffalo, because we are right next to the west side and North Buffalo. But that was my childhood life. I am also the survivor of childhood sexual assault and sexual abuse. I was abused by a close member of my family. And at 9, I let my mother know that something just wasn't right. At that point, I don't know who she spoke with or who gave her guidance, but as a part of the healing process, she made sure that I had someone to talk to. And so I saw a therapist for the first time, somewhere around 9 or 10 is when my therapy started. And my therapist was a Black woman. She was very nice and very sweet and reminded me of my mom. And I really didn't have anything to tell her because she reminded me of my mom. And if I wanted to talk to my mother, I'd just talk to my mother. And so as a point of um, perhaps reference or an understanding, again, that no group is a monolith, we often hear that people of color only want to see therapists that reflect who they are as a person. Well, I'll tell you this early at 11 minutes into our presentation and time together, that when I was suicidal, when I woke up at Erie County Medical Center after having trying to take my life, when I was in recovery at Brylin, I didn't care who the therapist was. I didn't care who the psychiatrist was. I just know that I needed to live, right? And so while I know that it is important that we have more therapists that are representative of the communities in which the people come from, I don't want us to get caught up in not being able to deliver service to people because you don't look like the person that needs help. When someone needs help, they need help. And so what does that look like as professionals? What does it look like as peers? What does that look like as community members? Believe it or not, we're all community members. All 69, 70, 71 of us are all community members. And so it is important and necessary for us to take off our professional hats and realize that we are them and they are us. And when we look at and talk about mental health, what does that mean? And so when I say community, I mean y'all too, like all of us. We are all community. While our hats may switch, right? We are all someone's child. Everybody came from a human being. Like we're all somebody's kid. No matter what that relationship looked like, we were all born to a family, no matter what that family looks like, right? And so I want us to, and I invite you to dive into your humanity, to dive into and acknowledge you as a person who has been called to do this work, and not to separate you from the work. That's intense and very difficult. And I honestly can't imagine what that work is like. I can imagine actually what it's like, and it's why I personally can't do it. To be a mental health professional that provides therapeutic services every day of the week. There is a level of caution and care that you have to take when it comes to hearing people's trauma over and over again, right? So how do you protect yourself? No group is a monolith, including therapists, including administrators, including peers, right? No group, regardless of what that group is a monolith. And it is necessary for us to practice self-care, which I know you've all heard before, but what does that really mean when you're talking about you as a person and not you as a therapist? And so or fill in the blank with your role here today. And so yes, we have to do more work by way of recruitment, and I'm not here to talk about that today. Yes, we have to do better in understanding people. That is why I'm here today and what that looks like. And so I personally found that my own therapeutic relationship, understanding the percentages, right? Like I'm bringing 70% of the work. Like I'm doing most of the work, and that other person is a guide. I personally found that I could get the most work done on me when my therapist was a white male. Black women And this is Kelly's story and Kelly's journey, right? Black women, I felt like, and still feel like, because I've been in therapy for so long, that I can help you more than you can help me. So my brain shifts when I'm working with Black women to that of a helper, right? But if I'm in a therapeutic situation, like, I'm there because I need assistance, right? White women, I found, and I know that I'm generalizing right now, right? But white women, I found, were very like over caring and couldn't understand how I could have been through so much. And I spent more time in those environments justifying me being okay, right? Like, don't worry how I'm still here. Like, I'm still here, right? Let's do the work. White men, I found, were more straight to the point, and that is how I dealt best with my, issues and my therapeutic journey. I will say my current therapist is a white woman, and she holds me to task, and we get stuff done, right? So while I needed to kind of explain those generalizations to you, I did not give up on dealing with a particular type of person because of my past experience. And so I share that with you because, again, no group is a monolith. And if that is your only takeaway today, let that be it. But with that understanding, that means Black folks are not a monolith, right? I just told you the one thing that is different than most everything that you've heard about Black folks in therapy. And that is okay. It doesn't mean that we don't need to do the work and do more recruitment and be better understanding. And so when we look at what that means and how that translates into care, when it looks like, when we talk about what that looks like, and I'm not saying any comment in the chat, so I need folks to start throwing some questions and comments in the chat. But when we look at cultural competency and cultural sensitivity, what does that look like? Oftentimes, and this is professional Kelly now speaking to you, I come across professionals, mental health professionals, that have taken cultural competency classes and have done all of the schoolwork and believe that they are now qualified to work with people of different backgrounds. Just because you pass a class doesn't mean that you have the cultural competency and cultural sensitivity to be able to do the work. I took accounting 3 times, and I have 3.5 degrees, right? I took accounting 3 times because I failed accounting 3 times. I have my bachelor's degree because they changed the requirements around the accounting program, and I was able to take managerial accounting instead of just general accounting. Just because I took a class doesn't mean that I could do the work, right? Do not ask me to add or subtract. I cannot. But I did pass accounting. And so I use that as a form of levity, but at the same time to kind of bring home the point that just because you took a class doesn't mean that you have the capability and competency in order to do that work. And so when you look at the work that we all do, and when we look at working with communities of color, it's necessary for us to be able to understand, again, no group is a monolith. And so when we say communities of color, people of color, Black folks, African Americans, Asian people, like, what does that actually mean, and how does that translate into doing the work? My office put together a health equity report, and I'll share that link in the chat with you. And I want to share something that the epidemiologist found in looking at the data. And so on page 7 of the health equity report, and this is the cover if you've seen it. If you already have it, this is the book that I'm talking about. On page 7, this is part of the executive summary, it talks about disparities and diversity within the Asian community. And what we found is that, first of all, when you say Asian, what are you talking about? You're talking about a group of people that When you divide up the population into these big buckets, right, most folks fall into that category. When you look at health disparities, we found that the Asian population, and this is for Erie County, had the highest rates in both the lowest and highest educational attainment category. So if you look at education, Asian people had both the highest rates of high education attainment and the highest rates of lowest educational attainment. How can that be? Well, when you're talking about Asian people, no group is a monolith. You're talking about folks that are from Japan, China, India, Philippines, Thailand. But we're talking about so many folks that are grouped into this one bucket. And people come here for different reasons and under different circumstances. And so when you look at health disparities, when you look at health outcomes, when you look at living conditions, when you look at life, when you look at resources, again, you'll find that people that are Asian are in the highest of all of these categories. So they make the most money and make the least amount of money. Well, how do you address that from a mental health perspective? Well, you have to understand that you're not talking about one type of person. Similarly, if you look at data and you look at the demographic of Black/African American, that is every person that's Black from across the planet. Like everybody here in America, here in Erie County, that is Black falls into that bucket of Black/African American. Well, if anyone knows someone from Jamaica or from the continent or from South America or any other island, 99.9%, I guarantee you, will not identify as African American. African American is reserved for Black folks whose ancestry and descendancy comes through American slavery system. So not all slavery, but very specific, the American slavery experience. Whole nother conversation that I'm not gonna dive into, but there is a difference between people that are Jamaican, that are from Trinidad and Tobago, that are from Cuba, that are from Ghana, that are from Senegal, that are from South Africa, that are from Brazil, right? Yet and still, they're all lumped into one category, Black and African American. Some folks may also identify as Hispanic or Latina, right? And so we, again, group all those folks into one bucket. When we look at Hispanic people, if you look at national data, the largest number of people that identify as Hispanic are Mexican. Well, when you look at Buffalo and Erie County, the largest group of folks are Puerto Rican. If you do not know the difference, I suggest, if this is a replay, press pause and go figure that out. If not, take a note because you have work to do, right? And so we cannot, again, group people simply based upon an attribute. No group is a monolith. What does that mean though? And how do we, knowing that everyone's now an individual, right? What does that mean? How do we move forward? How do we provide care? How do we realize and understand that cultural sensitivity and understanding is more than a class? I worked during 514 and as many of you probably did, and I was stationed at Johnny B. Wiley, and at the beginning of the not even healing, not just response, our initial response at Makowski. we had, and then, the next day at Johnny B. Wiley, there were a sea of white folks, well-meaning, right? I'm assuming I don't know, but we're gonna go with yes, right? Most folks were well-meaning and wanting to assist and wanting to help and wanting to respond to this tragedy. But the Black community, primarily African American, um, have been habitually traumatized. And so people seeking help, seeking to address their trauma, seeking to wrap their minds around just being Black in Buffalo, being Black in America, going about your day, right? Had to walk through a sea of white folks in order to get help. They don't know if those people are friendly, if they're kind. They didn't care. They're traumatized. And so when we look at dealing with a traumatized people, um, we and I am personally dealing still with my trauma and what it means to be Black in America. And while I never shopped, not I had been in that Tops a couple times, but I'm not gonna lie, it's a horrible grocery store. Like there was more beer there than juice, right? I had options in order to fulfill the needs of my family that most people did not have. And so I have not been into Tops, I'll say that, since it's reopened. And so I don't know what is there now, how the grocery store has changed, but it is still truly the only option for so many people to be able to take care of their basic needs. And so folks are still traumatized. I didn't have to, I was asked to attend the funeral of a Miracle Hunt who was shot a few weeks ago. She's 13 years old. She was with her best friend and was asked to attend as a peer specialist to provide just assistance, crisis counseling and assistance for family and friends that were mourning the loss of someone that should still be here, right? And I have 3 children. I have not lost them to gun violence, but I can't imagine what it would be like to lose one of my children in that way. And even though I have not lost a child to gun violence, as a parent and as a human being, right, I can not only empathize, but still feel the trauma of being Black in America, even though I've not had that very specific experience. The same is true for many people of color. Whether we have a specific experience or we have a vicarious experience. Again, that Tops for me was not a location or destination for me. Yet, simply being Black meant that people who look like me, whether they were Black, African American, or Black from the diaspora, can't even go to the grocery store without being attacked. When I look at the turmoil in France, I'm not French. I am not an immigrant. And so I don't have that experience, but I've lived here my entire life and understand and know the trauma and risk associated with being Black in a predominantly, we're no longer predominantly white society. We are in our thought processes and in our laws and in our rules and regulations and how we govern. And so again, I've never lost a child, but I can understand the grief that mom is facing, that her community is facing and that others in a similar situation are facing. And so you don't actually have to reach far in order to empathize, but that requires that you also have the help you need, you mental health providers, in addressing your issues. So, commercial break, hate to tell it to you, everybody on the planet has issues, right? And so, no matter how you're raised, no matter how you raise your kids, if you have kids, guess what? They got issues too. Like, just it is what it is. Try as you might, they have issues. No one on the planet is without them. And so, understanding that means that we are responsible for our healing. How many of us are doing the work that we're doing because of our childhood, good or bad, right? Because of a turning point in our lives when we were learning what life is, right? And so many of us do this work because of what has happened to us as children or young adults. And so part of that is also doing the work personally to heal. That means that we too have to go to therapy, just like we're telling folks that they need to go to therapy, right? We need to do the deep breathing and we need to do the stretching and we need to do the self work and we need to do, we need to do that. And so, as much as we work to help others through their journey, through their issues, we too need to do the same work. And I know it looks different for everyone, right? But I encourage you, if you are not openly on a healing journey, to begin looking at what your healing looks like. Just like, yes, a doctor needs a doctor, a therapist needs a therapist. And so, what does that look like? One of the things that my office does is we work to be able to make policy recommendations. And I briefly saw something about Erie County. My office works to make policy recommendations and pilot programming so that we can then make policy recommendations based upon that programming. And so that is one of the things as the Office of Health Equity that we can do. And so I wanted to ensure, because I know that mental health is such a overall upstream issue, that this office would do and could do as much as it could in order to help folks, be able to have the conversation around mental health and wellness. And so as long as we don't have the words to use, it is difficult to be able to have open and honest conversations around mental health, around economics and finance, like around whatever the topic is, healthy relationships. Like if you don't have the words to explain and to have a healthy discourse, then we are not really able to have open and honest communication. And so we started offering mental health first aid. And many of you, I'm sure, have heard of mental health first aid. We are offering it where people are and in the places that they are most comfortable. And so because we have leeway being the type of office that we are, we'll go anywhere. We'll go to a family reunion. We'll go to a synagogue. We'll go to the fire hall. Like we'll go to a tent reunion. Like it doesn't matter where people are. We will go where they are. My office is diverse, and we are able to not wholly represent Erie County, but we send folks that we believe the various communities across Erie County, right, will best be able to receive from. And so when we're looking at I'm Black, so I'll talk about Black folks. When we're looking at mental health in the Black community, um, what does the conversation itself look like, right? There are words that are used in a classroom that do not translate to community. And so I can say, read whatever part of the section of the book says that I need to read, but then I can translate that into, and I'm specifically using the word translate that into words, conversations, and language that is used in that community. So one of the things I don't know if anyone here is from the UB School of Nursing, but I worked with Dr. Yuping Chang and Dr. Susan Grenslade and others on Mellowing Minds research project. And that project was specifically tailored to introduce mindfulness to the Black community in Buffalo. And one of the first questions was, are you tailoring this to Black folks or are you tailoring this to African Americans? Because these are two different conversations, right? And so they were specifically tailoring it to the African American experience. Again, I encourage you to go do the work. That's not why I'm here today, to find out why those are different experiences. And in doing that, we had to be able to adjust the mindfulness language so that it was culturally relevant to people. And that meant changing the color on slides. It meant changing background music. It meant changing actual verbiage used. We used words like stretching instead of yoga because a lot of Black folks are not trying to do yoga. It's religious and cultural. Again, there's plenty of articles out there that can dive deeper into that understanding. I personally don't have a problem with either word, but I know that the community as a whole, understanding that no group is a monolith, right? But at the same time, you have to address the culture of a people. What does that look like? The work is not always easy, but it is possible. And so I encourage you to not shy away from doing the work because it is not easy. It is necessary and it is possible in order to be able to reach people in the spaces and places that they are in a way that is culturally responsible. And so I'll give you an example. Yesterday, I actually did a focus group in rural Erie County, and the group was a group of older people. They were all white. Again, I told you I was raised on the east side or east northwest side of Buffalo. And on the surface, I'm like, a Black person in rural Erie is not going to go over well. When I left there, not only did we have a great conversation and, they expressed thanks for me coming out, but they were happy that they had the opportunity to tell their story, that they were able to connect with someone who was not like them. But I understand as a community who these groups of folks are. It takes work to be able to do that. It takes reading, it takes conversations, it takes understanding, right? And a lot of you all don't get paid to do that. You get paid to deliver a very specific service. But in order to do that, you have to be able to understand people. And so a lot of rural folks don't know that their situation is very similar to a lot of poor folks in the east side and west side of Buffalo. Guarantee you a lot of folks on the east side and west side of Buffalo don't realize that their situation is very similar to that of folks in rural Erie County. Because we've put up these barriers and we've told this narrative over and over again about how everyone is so different. We're not that much different. The differences truly come by way of have and have not really differences in color and race. Are there differences? Yes. I mean, the health outcomes will tell you that there are differences. but it's not genetic, right? It's the systems that are in place. And so when we look at something like mental health first aid, and yes, it is tailored to meet the needs of the African American community. It is tailored to meet the needs of immigrant communities. It is tailored to meet the needs of refugee communities. Again, we group refugees and immigrants in the same category. They've come here under very different circumstances. We have launched mental health first aid in Spanish. My office has the first Spanish speaking position in the Department of Health, which boggles my mind. Not the first person that speaks Spanish, but the first person that has Spanish speaking in their title. Like, their job is to do their work in the community in Spanish, right? And so we are offering mental health first aid in Spanish. It is only available in those two languages. And so when we look at how we deliver services, it means that we have to look at things a different way. It is frustrating, right? The system does not allow it. But thankfully, we're beginning to do the work. I'm being real careful, y'all, because we're being recorded. Do the work in a way that is thoughtful, right, and purposeful, right? And so my office exists to have the tough conversations. If you look at the health equity report, there are two acknowledgments at the beginning of the report. One is a land acknowledgement, stating that the land that we're on is land that was taken from the original people. There is a enslavement and labor acknowledgement, stating that we've made it as far as we are on the lives of predominantly African and African American folks. It took me a little while to realize that when I speak, at least Monday through Friday from 8 a.m. to 4 p.m., I'm speaking as the government. And so the government, through this report, right, has said that the land that we're on is land that was stolen. It says that the things that we have were received, were obtained through horrendous methods. And so it is taking advantage of our voice, right? And using it to the benefit of all people. In what world would you expect a Black girl from the East Side to fight for rural folks, right? Because we're taught that, oh, you can only fight for your people. Well, we are all the people. If I don't use my privilege to uplift everyone, if I don't use my privilege to amplify voices of those that are not heard, if I don't use my privilege to ensure that everyone is being brought along in the conversation, then what is the use and good of having privilege? And so we all have privilege. I have tough conversations with my friends and family about LGBTQIA issues, because if I don't uplift their voices, then I'm leaving people behind. If I don't uplift the voices of Black folks in places where I'm the only Black folks, then I'm leaving people behind. And so whether we're talking about mental health, whether we're talking about economics, whether we're talking, regardless of what the conversation is, we have to use our privilege in order to ensure that we're not leaving folks behind. Because what happens is, again, regardless of the topic, if we are not bringing all folks together and we're leaving folks behind, we all fail. There'll be short-term gains, but long-term, we all fail. At some point, the system catches up with you. And so I'm just gonna scroll through real quick for comments, and Kathleen, unless you see something that you want me to address. We're at 1:45. I want to make sure we have time for questions. I think I went back too far. So the report is available at that link. You can download it. It's the Health in Erie County report. It mentioned in their survey, we did a survey, and I was purposeful in having outreach done in various communities across Erie County that are not often heard from. Typically, when we do the community health assessment or any other survey, the primary respondents are middle-aged white women. All due respect, you know, there's more people in Erie County than middle-aged white women, educated middle-aged white women. And so we had to go out and get the responses of everyone in Erie County. And so we did that and worked with the Buffalo Center for Health Equity and the Witness Project. And we were able to get with over 3,000 responses to the survey, which is massive. 3,000 real human responses. We had about 5,000 responses that included bots and stuff. And so we are now going into communities that were not well represented. And that includes, like I said yesterday, we were in rural Erie. We're going to the holding center in Alden to talk to incarcerated men and women to amplify their voice. We are going into Somali community and 3 other that the focus groups are being translated and interpreted. We're putting the final touches, so I don't know which of the groups we ended up working with. But I do continue and want to continue to be very intentional in our work in amplifying the voices of people that are not heard. And so that means, one, acknowledging that everybody has a voice. It's just a question of whether or not you're hearing and listening. And so one of the things that I would, reading a question, and so the question says, and this is to the point that I was about to make, what can I do as a therapist if there's resistance with minorities and people of color in counseling due to negative and previous negative experiences in therapy? You know, so I'm Christian, and that's not a good example. It is a good example, but it requires too much conversation. To specifically answer your question, acknowledging that there's an issue, right? Like the healthcare system sucks. I'm willing to say that. Acknowledging that Erie County, regardless of administration, so this has nothing to do with who's been elected into office. It's the government. It's a bureaucracy. There are layers upon layers upon layers, and it has to function that way because that's the way it was built. And so how do you rebuild it? Not just the county, the city, a town, the state, the federal level. It all functions the way in which it was built. And so we try and adjust, but simply saying, especially when we talk about medical mistrust, listen, the government has done some foul stuff. And as a government employee, I'm saying that out loud. I can only speak for myself. I can only, in this case, be a therapist, you know, and show you through my work who I am as a person, right? But acknowledging that there's hurt, acknowledging that there's pain goes a long way. No, you can't accept responsibility for changing the entire system, but you can accept responsibility for changing yourself. And so how do you show up knowing that these things exist. Call it what it is. Like racism is an actual real thing. Gender issues, actual real thing. Homophobia, actual real thing. People have been killed because they do not conform to society's ideals, right? Like, period. And while none of us, I believe, and this is not scientific, but none of us fit naturally into society's ideals. We all bend just enough to be able to fit. Some of us have no problem bending to fit in. Others, it's impossible without breaking, right? And so being able to have that conversation, I think goes a long way in establishing the foundations for trust. And it's a lot of people that don't think that equity is a real thing. I really don't care. I know that it is, and I am called, motivated, moved to do this work, and so I'm willing to leave my job. So this is Kelly speaking, right? I am willing to leave my job over every decision I make. That's how much I believe in the work. I'm not saying that other people have to do it that way, but if I speak on it, I mean it. And I'm willing to repeat it, and I'm willing to stand on it. And so I'll leave that piece there. Let me see. Kathleen, let me know if you have something. I'm still scrolling.
Yep. I'm just kind of scrolling through some of the comments, questions here. One came in: my concern or challenge is wanting to use my privilege to support and lift up others, but don't want to make the error of speaking for them.
And so, prefacing things, it's been my experience, right? Like, I spoke about me and my experience. I don't know all Black people. I might know a lot of them, but I don't know them all, right? And so I can't speak for all Black people. And anytime I am speaking on behalf of a group, it's based upon data or based upon a report. And I say that, like, this is based upon the research I've done. This is based upon my experience. And when those folks are in the room, I defer to those folks, right? I'm going to assume that if you are Asian, you probably know more about being Asian than I do, right? And not saying that an Asian person can speak for all Asians, because they can't. Like, it's not possible. But it's allowing people, again, acknowledging everyone has a voice and amplifying the voices of people that may not be in the room, and supporting those who are, so that their voice is heard. I really hate being the only Black person in the room, because then I feel like I have to represent all Black people. If there's another Black person there, you get a whole different Kelly, because I'm dropping conjugation, like I'm really showing up as Kelly, because I don't have to worry about covering for nobody else. Same thing for being a woman. Like, if I'm the only woman in a room full of men, like, I feel, this is me and my personal issues, right? I feel like I'm representing all women. Do I? No, but that is who I am as a person, and how I deal, right? And so that would be my suggestion in that regard.
Great, thanks, Kelly. Another comment was: there's a difference in perspective between Eastern and Western practice in mental health, as with medicine. More attention should be given to this.
100%, 100%. And so one of the things that we are looking to do is we're seeking funding to be able to provide holistic services, health services that kind of bridge those two pieces. Again, it's a spectrum. It's not, one or the other, but how can we, again, like, my office is the government. So if we have a pilot project that is bridging those two sides of the spectrum of medicine and health and healing, what does that look like? And what policy recommendations can we make based upon the research that we've done? And so, yeah, I agree 100%.
Going back to the EAP piece, someone commented, I love EAP, but I always felt it wasn't long enough, like 3 to 4 sessions, and that I wish there was a policy that would make it longer.
Wouldn't that be great? Like, it doesn't get good till session 3, and is there a way to, y'all know that the first couple sessions are like, so how many siblings do you have? Like, it took me 3 months to get here. I really don't want to talk about my siblings, right? But as professionals, there's questions, that have to be asked. And so how can you begin to change what those initial conversations look like to be able to help people get what they need faster? But yeah, I definitely think EAP should be longer than 3 or 4 sessions. And I feel like not enough people use it. So resources are not, although more folks are probably using it now. There's probably more funding there.
You might have touched on this, but a question came about offering mental health first aid training that's tailored to the African American community.
Yes, and so again, we cover a wide spectrum of people. If anyone is interested in mental health first aid training, Erica Rouse and Eddie Payne are the 2 folks that lead that initiative. You can tell them the type of community you serve or the type of community that you're interested in booking mental health first aid training for, and they will send someone who is responsive to that community. And if they don't have someone, they'll let you know that that's not an area we cover, but we do have people that fill in the blank and would be ideal from our perspective in being able to lead that training.
A lot of feedback, Kelly, just coming in on thanking you for sharing your experiences, your perspectives, your story. So thank you.
Thank you all for being here. I appreciate it. The other thing with mental health first aid, we bring the books. There's no cost to schedule or hold a training. Again, we'll go wherever people are. We bring everything with us. So we just need people in the room and we can do the rest. And so if that is something that you're interested in, please reach out.
Great. Just looking at the time here, wanted to thank you, Kelly. This was great. Thank you, Amy, for coordinating as always, and thanks for everyone who's on the call and participated in our session today. Amy has pasted the link for the evaluation in the chat box. It's very brief, so if you could just take a quick moment and fill that out for us, that would be helpful. Again, the recording of today's presentation will be posted to our webpage, and that'll be up by next week. Keep your eye out for future sessions, as well as our August session. You can check our website, or we will be emailing notices out as well. Again, if you're interested in being a presenter or have a topic that you're interested in hearing about, please let Amy know. You can put that in your evaluation, or you can email Amy at amy.rockwood@erie.gov. Again, thank you, Kelly. We appreciate the time and wonderful presentation, and thanks to everybody who's part of our collaborative.
And I put our email address in the chat. It's healthequity@erie.gov. If you do a copy and paste and it doesn't work, it's because I spelled health or equity wrong, but it's healthequity@erie.gov.